Using insecticide-treated mosquito nets has for long been known as one of the most effective measures against malaria. However, some experts think that you may not need this net after all.
It doesn't mean that the mosquito nets will be lost from the country. No, they shall be used because we use mosquito nets to repel or to keep away the mosquitoes, which are a nuisance.
That's about it, but it's not keeping malaria at bay, according to retired Dr. Charles Sezi, who assured the gathering from the Ministry of Health and other development partners like WHO and UNICEF that it's about time the mosquito net got thrown out as a preventative means against malaria.
Quarantine, forget. Vaccine, for the time being, forget. So we have only one thing to resort to. That's to cure the disease, to remove the parasites from the human body so that the mosquitoes will have nothing to carry.
Dr. says, partly is right. Where you have a prevalence rate of malaria more than 70%, putting a net and expecting people to be protected, you are protecting nothing but protecting the mosquitoes, rather the parasites of malaria. In such a situation where you have a high malaria prevalence rate, you should treat everyone first, then put a net.
This is said as a team from the Kenya Medical Research Institute, KEMRI, released a report funded by the UK government profiling the disease from its control to regions with the highest incidence rates in the country. In the report, nets are cited as a measure that has been helping in the malaria fight. The Ministry of Health has, however, encouraged the sustained use of the nets alongside other measures.
You will note that the mosquito nets are mainly useful when people are going to sleep. So there is that time when people are seated, whether in the kitchen or outside. And of course, as we all know, most of our homes in the villages, where we have this biggest challenge, people also do not clear the bushes around the homes.
There is no single shot that sorts out that problem. We need to pull up our socks and be serious at implementation.
When it comes to nets, only 4 districts have over 50% coverage, and they are Chiruhura, Chiboga, Masindi and Riantondi. However, Dr. says and others who share his view question why Chiruhura is amongst the 10 worst hit districts, yet it has a high net coverage. The other worst hit districts are in eastern Uganda, including Jinja, Mayuge, Iganga and Budaka.
In Uganda, you start off with a very high malaria transmission intensity in the eastern region, in the northern region and in West Nile. Now what happens is if the intervention is not very good, then it doesn't drop. So in the northern region, I think with indoor residual spraying, it is beginning to come down. In the east, I think intervention coverage is still below 30%, so it has not yet come down. But for 25 districts, at least they have had a 20% reduction, so that's the good news. And then for about 4 districts, more than a 50% reduction, including Kampala, which is also very good news for us.
In the report, only about 4% of the population, or a little over 1 million Ugandans, live in areas that are free of malaria, out of the over 34 million people.
The only thing that can bring down the rate fast is IRS, indoor residual spraying, using a susceptible chemical that can bring down those infected mosquitoes.
The World Health Organization requires that 80% of the population have either an insecticide-treated net or they are protected by indoor residual spraying. And 80% of the sick people access treatment within 24 hours.
Between 250 to about 1,600 infected mosquitoes bite one Ugandan per year, with 3 most known dominant vectors, all Anopheles. Florence, NTV.